Okay, hi everybody. I'm Dr. Mark, student, and welcome to our Corona virus practice strategy session. These are unprecedented times. And by the way, someone is talking in the background. Can everyone please mute your microphones? Everybody, okay? If you need to say something, then unmute it. Okay, that's very, very important. And if it gets abused, I'm just gonna have to mute everyone. Now, with that being said, these are unprecedented times, and out of confusion comes clarity. Out of fear comes power. Out of preparedness comes success. So what I want to share with you is there's a tremendous amount of confusion right now. There just is. Are we essential services or are we not? The Federation of Chiropractic License Boards sent out a decree yesterday that we are considered essential services. The governor of Kentucky sent a note yesterday that we're not and that we need to close down. I mean, this is really a state-by-state issue. But in reality, to put it, Stephen Virginia said it the best. He said, I'm closed from Monday on, this past Monday. I want to be part of the solution, not the problem globally with the pandemic, and not really contribute to any issues. And someone else in Georgia said, listen, I have a responsibility to my patients. Many of them are in pain. How could I turn my back on them? And the answer, the real hard answer is there isn't one, because there is confusion, but clarity is coming out of it. And what we're doing today is to help create a little bit of clarity. Now, this is about the third or fourth transmission that I've given you on this between emails, and this is our second live webinar, really to put everything together of what we're going to do. It's going to take about an hour to really go through this. And I want to share with you the last or second to last slide is probably the most powerful, because we have to prepare for opening day. And opening day is when we as a nation and we as a society and we as a planet get the green light to go back to our normal lives. Lives will normalize, I promise you. It'll take 2 weeks, 4 weeks, 6 weeks, 8 weeks, 10 weeks, but lives will normalize. And I do want you to know that the song was Glory Days. It is Glory Days, and we're blessed and we're thrilled. And with that being said, my heart does go out for those people who are suffering, the people who are ill, and we've got many people that we know that are deathly ill right now in the New York area and that are suffering horribly, and our prayers are with them. And the people who can't put food on their table, our prayers are with them. And the people whose businesses are going under, our prayers are with them. And we need to exercise just the greatest amount of tolerance, the greatest amount of charity, and the greatest amount of understanding to our communities. Sorry about that, I turned my phone off. To our communities, because we need to lead in this time of crisis. We need to be a beacon of hope to all of those who are suffering. We don't need to browbeat anybody and thump our chests and say why we're number one and why we're a 10 out of a 10. You hear a lot of that rhetoric on the political trail. That's not us, okay? And this is not a political statement. This is a humility, humanitarian statement. And our patients need us, and our families need us, and our communities need us to actually lead from humility, from support and understanding. And I can't say that enough. Whether it's a phone call, whether it's helping people in financial need, whether it be our staff or family members. And I'm going to give you a lot of solutions today for helping staff and other things in financial need that are incredible solutions for you to do that, because we're in a position to do that. And that's just extremely, extremely important. What I put out 2 days ago is a statement which I actually love, and I'm going to read it again. Many of you weren't here. And it says, as we stand at this crossroads of history in these unprecedented times, today we will emerge stronger than before. What you do now will determine how strong you will be. You are in control and have the power to dictate your own success. Folks, you are in control, because what you do over these next few days and weeks, and hopefully not months, but if so months, will dictate what happens on opening day. And opening day is critical to the overall success of your practice. You've got rents or mortgages to pay. You've got food to put on your family, on your table. You've got your family to support. You've got a commitment to patients that you need to maintain. And opening day is where we are focused on right now. We're not focused on today and tomorrow, even though there is a myriad of action steps I'm going to give you, more so than you can imagine, and there'll be more even to come. But you need to focus on opening day, because opening day is critical. And you see this, you need to call me. You're going to have weak moments. I promise you, you're going to have weak moments. You're going to have uncertainty. There's going to be challenges in relationships. There's going to be challenges, hopefully not in health issues, and hopefully you won't be affected by this and you'll be a bystander. But if you are, call me. We'll chat, we'll talk. I don't care if it's early, morning, noon, or night, early or late. You call, I'm here. And by the way, I also need to hear from you, because it helps keep me clear, and sometimes I get a little frustrated. It's a two-way street. Before we do start, I'd like to make a few acknowledgments and thank people. This presentation today was probably, over the last 2 days, about 50 to 60 hours of preparation. Now, there's only 24 hours in a day, because I didn't do it alone. I'd like to thank sincerely Dr. Michael Barone from Connecticut. Michael has been incredible. Michael, if you're here, thank you so much for your contributions. Dr. Ron Manoni. Michael, by the way, is our electrodiagnostic specialist. Dr. Manoni writes rebuttals for IMEs and peer reviews. Ron has been unbelievable, working all morning. I'd like to thank Dr. Steve Lininger in Virginia for a lot of his contributions and giving me access to different information at the federal level. I'd like to thank Dr. Matt Erickson for his contribution in helping do forms and templates and resources. I'd like to thank Dr. Michael Schoenfeld for his contribution. Michael writes our, does the, come on, Mark, I just drew a blank. The narratives for attorneys, the narratives done for you. All of these people have contributed and deserve a very sincere thank you. And Dr. John Centineo for providing a tremendous amount of forms. Dr. Alex Grayo down in Florida for providing forms as well. I think I got everybody who've actually contributed, and I'd like to thank everyone sincerely, from being selfless, of giving up their forms, their time, their documentation, because it's about helping the greater good. It really is. It's about helping the greater good. It's not just our clients. And I want to put this webinar out, and I'm recording it, to the profession. Now, you, my clients, have access to things they won't, but I really want to help the profession, and I think that's important, and I wanted to share that with you. And they're not going to get this till next week. So, number one, here's what we're going to talk about today. What to do with your current patients in your office. What to do in a telemedicine scenario. Automated. I have an automated web-based solution, paper solutions. And we've created those for you, those documentations. What to do with your time. How to manage your staff, and talk about the FSLA labor laws. I am very blessed to have in my life one of the nation's leading labor lawyers who understands all of the laws from a labor perspective and management, both sides of the coin. And he's been very giving of his time in explaining these things. We're going to talk about preparing for opening day, communicating with your current patients. We're going to share with you a lawyer's webinar that we're going to do to keep your referrers engaged. And the first seminar is going to start next week. And any one of you, everyone can invite all of your lawyers to attend. There's no limitation. Anyone can invite anyone. And we're going to put the specifics of that out starting on Monday. Finances, we're going to talk about financing. And we're going to talk about small business loans, where you can actually get debt forgiveness if any of those loans are used to pay your staff salary, that you could get forgiveness for that. So we're going to be able to share with you that information and give you resources and phone numbers and things to do. So we've been really busy researching this. Our goal, we want to create a stronger practice today that will endure the balance of your career regardless of the obstacles. You know, it's funny, in 1993, I was really blessed and given the honor of being named the Chiropractor of the Year in the state of New York by the state organization. And interestingly enough, the person that presented that award to me said, "I'd like to introduce Mark to you. Here's Mark, okay? There's a brick wall. He's going to go through that brick wall, not knowing if there's a sheer cliff on the other end till he gets there. But you know what? He'll figure it out." And that's how he introduced me. And I'm saying to myself, was he saying I was dumb enough to go to a wall and not know what's on the other side, but smart enough to be able to figure it out? And to this day, I don't know. It's kind of one of those life's riddles. But we don't know what's on the other side of the wall, and we are figuring it out together. I don't do this alone. I do this with everyone, and together we're going to figure it out. There are extremely bright days ahead of us, and there are bright days right now if you use that time wisely. And I mean that sincerely. Now, again, we're not in this alone. I just want you to know you are not in this alone. I'm here and all of us are here with you. You have a problem. How many times have I said, I want you to call this person, here's their phone number. I want you to go do this. I want you to go do that. Call these people. We're not in it alone. There are some very bright people in our organization, perhaps the brightest minds in our industry, because we're not about quick fixes, and we all know that we're not in this, for a quick fix. There's no shortcut. There's no get rich quick program. It's roll up your sleeves. We're going to go to work, and we're going to do it together. And look, we might have had our differences on any issues, but that's okay. It's family. You don't have to like what I say. I don't have to like what you say. We're going to duke it out, and at the end of the day, we're going to be hugging because we're on the same side of the table, and we're going to figure it out together. And by the way, if you're part of my program now or not part of my program now, my phone works for everyone, because in these crazy times, we're all in it together. Now, let's talk about in-office. And by the way, if you're a member of the program, email me for a complete set of documents. Members are entitled to a complete set of documents that are pre-done. Everything we've got completed, and I'm going to put dozens and dozens of documents up here. So again, the members of the Doctors PI program, you're more than welcome to these. Just email me. If you have patients come in, and I could thank Dr. Matt Erickson for this document. This is screening, not to tell people to go to a screening site or a hospital or a testing site, bless you, but to see if in fact they can come into your office, because you want to ensure you're not infecting people. So, whoop, I can't believe I just did that. Sorry, that's it. Now, what you want to do is every patient that comes in, hand this to them, okay? And have your staff do their blood pressure and their pulse. You also might want to add a pulse oximeter to see if their blood oxygen level is going down. That's indicative that there's some kind of perhaps virus or infection kicking around in their body. But this protects you from your patients. You, as a healthcare provider, must be protected from your patient, and that's critically important. Now, in-office procedure, and this is a note that I suggest if you keep your office open, you send to your clients. And you've seen this, if you're a member of mine, you've seen this last week, but it's been amended. Due to the coronavirus issue, and coronavirus is one word, our nation is facing, we are taking extraordinary measures to ensure your safety with our office so that you may continue, so that your care may continue. Here are the precautions we've enacted in our office. Our staff is being limited to only essential people to treat patients. The rest are asked to stay home. Our entrance door is disinfected between every single patient. Our floors are being disinfected twice daily. I and other providers who have contact with patients are disinfecting our hands between every patient, or you can wear gloves and throw them out, but they're hard to get if you run out of them. The treatment tables are being cleaned in front of you prior to your treatment. You have an option of waiting in your car, and we will get you to come into the office when the time is right for your care, for your appointment. So you really want to isolate as much as you can. These are extraordinary times that require vigilance and extraordinary measures. We urge you to continue your order treatment plan. However, if it is challenging to keep your appointed number of visits, do the best you can, and we will accommodate you every way possible. We look forward to life normalizing, and we will do everything within our power to ensure your health, happiness, and safety. Now, in states like California and now in New York, as of midnight tonight, you're not allowed to go out. We're in self-isolation, except for things like grocery shopping, pharmacies, I believe hardware stores, because they have cleaning supplies. But we're all self-isolated. But if you do have patients coming in some states, I know in South Carolina, it's still very robust. Just because at this point in time, it's not prevalent by the numbers, it's more of an issue of the testing kits really not getting out there yet. So you're seeing those numbers skyrocket because now those first wave of tests are starting to come in. So just be very, very careful and very, very vigilant. Now, regarding current patient management, the first thing you're going to do, come on, Mark, is you're going to get a list of your active patients. And you need to define your current telemedicine practice. So if you're going to be at home, and by the way, if you're working from home and you want to get into your computer and you're on a PC, if you're on a Mac, you're on your own. But if you're on a PC, there's something called Microsoft Transfer Protocol. And in the bottom left of your computer in the search bar, type MSTSC. Mark, Sam, Thomas, Sam, Charlie, MSTSC. And what you could do, you just need your IP address, and you could actually dial onto your computer in your office, just like you're there, and leave that connection open continually. But short of that, if you're not technologically adept, take all your your active patients, take them all home with you. Your patients' charts, take them home with you. Number two, you have to communicate with your patients. Patients need to understand their care cannot abruptly stop. It is not in their interest if they stop care abruptly, especially if they have a personal injury case. It can be held against them. And that's critical. And I could just see some low-life defense lawyers saying, well, you interrupted care. Well, it was during the coronavirus. Well, I guess if it was that important, you would have done something. You would have documented home care. The doctor would have communicated you. You would have done telemedicine treatment. So I guess you really didn't need that care in the first place, did you? And it all depends how they spin it, depends upon how a jury or a judge would relate to that, which will grossly affect the case of all the attorneys that you work with. So it's incumbent upon you to understand the process. Next is you have to create a treatment protocol for home care. Now, the next sections are going to give you choices on how to create protocols and how to document. But the first thing I'm going to do is give you a script. This is a script on patient communication. And I'd like to thank Dr. Manoni for helping me do this. I paraphrased it. And here's what you do when you make a phone call. Hi, Mrs. Jones, this is Dr. Student. I'm calling to have you continue your care at home during the crisis. I've created a treatment plan for you involving a home exercise program that can be done in your living room, which is easy. And you only need to write down a few things for me. I'll be speaking to you twice per week to document your care and be able to monitor your neck condition, back condition, whatever it is, while discussing and answering any questions concerning your exercise, nutrition, posture, body mechanics, whatever it is that you're discussing with them. This is whoever has music or talking in the back, mute your microphone. This is also critically important for your accident case, as non-participation might be construed as you not having real injuries. This will be a billable event to formally document your care. Here's what you need to do. You ready to get going? You know, you're letting them know who you are, what you're doing, billing is involved. For non-personal injury cases, it's the exact same thing, and it says this is being billed as a telemedicine event, and here's what you need to do. Okay? So very, very simple and very straightforward and full disclosure to your patients. But you need something to bridge the gap, and you could use whatever language you want. I just wanted to make this nice and tight for you and create a script. Now, when you do your telemedicine program, and telemedicine is huge. Most states have created emergency provisions in doing telemedicine paradigms. And by the way, yeah, Jeff asked a question. Jeff White, we'll talk about 3 times a week. And it's a good question. Is 3 times a week too much? The answer is yes. I would say twice a week is the max. But here's the thing. When you're doing telemedicine, let me just stretch for a second. Okay, you have 2 choices. An automated web-based solution, which I personally would do, or a paper-based solution that Larry wants to do, which is fine. And by the way, both work just the same, okay? So I've been on the phone since Wednesday calling dozens of automated web-based programs. And Chris McNulty down in North Carolina introduced me to Web Exercises. Web Exercises is owned and run by a chiropractor who supports the profession. He's out of San Francisco. He's now my new best friend. So I think that is a great program, and that's the company that I would support. The others are conglomerates. I speak to people in 73 different languages and accents. I can't, not that that's bad, but I like to keep it home, which is important to me, and keep it within the profession. Let's talk about number 1, okay? Telemedicine, the Web Exercise people. What they do is they give you, which works across any device, a cell phone, a tablet, an iPad, a laptop, a desktop, it doesn't matter, is they give you hundreds of choices: cervical, thoracic, lumbar, shoulder, knee, elbow, etc. And you could just go on and click treatment protocols for your patients to do, okay? And then what you're doing is your exercise prescription through them makes it, whoever's talking, stop. Okay, I don't get a list of that, or I would just mute you myself. Yeah, Mark Slamowitz. Mark, turn your microphone off. Okay, so I'll turn it off. Okay, now, so what they do is they give your patient all of these things. There are pictures, there are videos, there's explanations, and I already spoke to him. Some of his explanations are wrong. We're going to work on fixing that next week. But this is what you get to do. You get to create a prescription, okay? And this is what your patient gets, okay? They'll get something like this: the provider, facility, duration, and it'll say you need to do 3 sets, 10 reps, 30-second rest in between. And it shows you what to do. Horizontal Y instability ball, or something on the floor. I mean, I wouldn't pick balls because people don't have that at home. But again, you know, dead bug, you get to choose which ones you want. So step number 1 is you go on the portal and create the treatment order. Step number 2, you communicate with the patient in a telemedicine visit how to get their treatment orders. Tell them and you're going to email them the link. Number 3, what the patient sees based upon your treatment orders, including visual examples with sets, reps. They're going to see all this stuff. They get to see everything that they need to do. Then as they do it, step 4, the patient fills out the reps per set. This is what the patient is filling in. They're getting something on this right here, when you start the program, that they're going to say that sets 3, set 1, they did 10 reps. Set 2, they did 10 reps. Set 3, they did 10 reps. And if there's a pain level in that, they're going to report pain levels. Very important. So you then review the patient's portal. You're going to call the patient, I recommend twice a week, and then you're going to create a SOAP note, subjective, about the home treatment and what when you're communicating with them, just like a standard subjective. O is going to be the ordered results. This is your ordered results right here of what of what your ordered results are. A is assessment, which is going to be your diagnosis and assessment. And P, unfortunately, it's not your treatment. P is going to be what your plan is for the future. And you're going to try to get, it's challenging in a home-based scenario how to mimic it in office, but this will cover you for documentation needs. Now, remember, when you speak to someone on the phone, you have to document all of those things, plus the clock time you started, the clock time you ended, and you must put the total time spoken to the person. Those are the three things. 4 web exercises. Go onto their site, web exercise, and you could go to their sign-up site, which is here. You put the discount code, that's $349 annually. I negotiated, rather than me getting a kickback like everyone else in the world does, I just pass that savings on to you. Academy of Chiropractic members, it's $249 a year. Okay, one fee. You need the discount code Academy of Chiro 100. Okay, and if you have any questions, you call Misty. Write this down. Discount code Academy of Chiro 100. Very, 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 very important. Now, if any of you want to watch this entire program again, just shoot me an email and I'll send you a link, which is really easy. Now, paper solution. Okay, Larry, this one's for you. Here's paper solution. Manually deliver, review and document home exercise program. Step number 1, call the patient and explain the program. Number 2, email, fax, or snail mail home exercise program protocols. These are the sheets courtesy of Dr. Centineo. Okay, there's a bunch of different exercises on here from John's, and over time I'm going to get much more sophisticated ones. Alex, I know you sent me yours down in Florida. It was great, but it's all copyrighted, and I didn't want to take anyone else's work. So we went really old school, and there's about 10 or 15 of these, I don't remember, but all different kinds for you to send your patient. Then you call the patient and review their progress, and then you document. And members email me for a complete set. Now, here's your SOAP note, okay? I've taken what our daily SOAP note look like, and I've created SOAP, okay? And this is on paper. Subjective, ordered home treatment, assessment, diagnosis on the back, put your diagnoses, and your plan or treatment for the future, okay? What they should do to continue, sets, reps, pain scales, frequency per day, okay? And actually, this is what they reported. This is the subjective, what you ordered, etc., plan treatment, and your CPT code can go down here. So this is all the things you need to document. The other thing actually I did not put on here is time start and time stop. That'll go in the doctor's notes. And I should have just add that in here. And members, you can email me for this. EMR users, contact your EMR company for guidance on documentation. I spoke to ChiroTouch this morning. Hang on one second. They do not have a robust solution. They have a solution for billing, but not documentation at the moment. So I put them on alert for that, and I don't know the other EMR systems. You have to communicate with them. Okay. Will the scripts be the form in the packet? You know what? Your prescription is going to be here. This is your order. This is your script. Daily note, this is your treatment order right here. And Scott, that was a good question. This is your prescription right here. And that's what I would do now. Can we telemedicine with a patient that came in for an MVA, then has to go out of the country for a couple of months? Corey, probably. And Corey, by the way, good question. Corey, I need you to call me later. I need to chat with you. Okay, now, coding. We looked at a lot of different coding issues, and 99441 is the right coding. 99421 is if a patient initiates the coding, and a 99441 is if a doctor initiates the coding. And the OCR, the Office of Civil Rights under HHS, Health and Human Services, will exercise its enforcement discretion, this is on their website, and will not impose penalties for non-compliance with regulatory compliance under the HIPAA rules against covered healthcare providers in connection with the good faith provision of telehealth during the COVID-19 nationwide public health emergency. This notification is effective immediately, meaning that during this public health emergency, they're really not going to come down hard on you if you break a HIPAA issue. And I assume, and I don't know this factually, a coding issue. We've been looking, we haven't found anything if you're doing it wrong. So that's just, you know, just a note that we found. Now, coding. Disclaimer, the Academy of Chiropractic, CMCS Management, Doctor Student, or any of its affiliates does not set codes or fees. This is up to the doctor to make a clinical and billing decision. That's entirely up to you as to what you will do regarding coding. Now, I recommend for fees, you use the medical fees in the United States by Physicians Medical Information Corporation. That's medical fees in the United States. You can buy it on Amazon. You can go to them directly. And there's a geographic modifier by zip code. You can find out the appropriate code for you to use to make it legally defensible. 99441 is a 5 to 10 minute discussion. And I would say this probably will not be your first phone call. Telephone evaluation and management service provided by a physician to an established patient, parent or guardian not originating from a related E&M service provided within the previous 7 days. You could waive this, by the way, I believe, and I don't know that factually, nor leading to an E&M service within the next 24 hours. They're not coming in, so it's a moot point. 5 to 10 minutes. 99442, 11 to 20 minutes, and 99443, 21 to 30 minutes. I would gather you're going to be at a 2 or a 3 for your first patients. And by the way, even if you're still seeing patients, some aren't coming in, I urge you to start living on the telephone because you are going to be busy. The lowest reimburser is New York State, which is like $28 and change. And then the highest reimbursers go like $110, $120. I don't know what state that is, but go by the CPT book. But you know, you're still garnering income, money's still coming in, you're managing your patients, you're keeping them involved. You're keeping them involved in your care. And that's what's important, extremely important. Now, Rob from Mississippi said, how do I know my state and the insurances allow telemed what Chiro can use? You're allowed to use this. We're all allowed to use this code. Usually like New York and Ohio just set rules, but on the workers' comp side. There is no preclusion of rules on the personal injury side, and managed care is really predicated upon contractual relations. So I don't think you're going to have problems at any level. I would simply do it, put it out there, not be concerned with the rules. I would bill it appropriately based upon the fee book that I've been sharing with you to get from from day one. And the reason being is you need to keep your patients engaged. Remember, opening day is coming, and you want all your patients to come in and bake you a cake and thank you for the time you spent with them on the phone, because you're just schmooze with them. How are you guys doing? Is everything okay? Is anything else I can help you with? You really need to engage. Now, Rob, you asked about Medicare. I don't know the answer to that. I have no clue, none whatsoever. I really don't focus on Medicare, but go to CMS on the web and just type in telemedicine and see what they have to say. So I don't know the answer to that. Scott, what do you want to know about Ohio? I just said it. Oh, Scott said Blue Cross Blue Shield said telemedicine had to be their own doctors. United Healthcare said only allow doctors or in-network providers. So again, yeah, if you're an in-network provider, that's important. But I really don't care. I'm going to do it anyhow to keep my patients engaged. It's just that important because opening day is coming soon and you want them to all come back. Now, there's a GT modifier. If you're not allowed in some instances to use a 99441, depending upon your state, they might make you use a 99212, a re-eval code. And some states make you do that. But use the GT modifier. It tells the payer that the provider delivered the medical services via telemedicine. Medicare does require to use a GT modifier. So Rob, this does answer your question. It is allowable in Medicare, but I don't know those rules or regulations, so you need to get into that, okay? That answers your question, hopefully. Now, documentation requirements beyond what I showed you a moment ago. You have to have the date, the participation, you have to put their name, and your name and your title, so make sure it's on letterhead, the length of the call, clock time, and the nature of the call. It's already in that form that I gave you. And all medical, vocational, or return to work decisions, this is just medical. So everything is in that form, and if you're going EMR, use the form that I created for you. Use this form as a template of what to put in your EMR. Sometimes old school paper, you know, Larry, your solution might be the best. Sometimes old school paper is your best bet. Now, how to spend your time right now, and that's important. And we talked about this before. If you're one of my clients, you've got so much material that you've either read and forgot or didn't read and get to yet. So I urge you, go back and read, listen to the podcast, watch the videos, do everything. And if you haven't had a compliance review yet, you must. I do have a relationship, as I've shared with many of you, with some of the attorneys from State Farm, Geico, and other carriers. And I understand what the needs are, and it's changing. The needs are changing. So you need to take that time and use it well. But beyond that, you have to ensure that you have your appropriate level of credentials. Get educated. Spend this time not to clean out your closets or to clean out your garage. Spend this time academically. Get trauma qualified, hospital qualified, E&M qualified, primary spine care qualified, expert witness qualified. Right now, we have lawyers and medical providers around the country reaching out to us and say, please send me your list of qualified doctors. I want to only refer to them, and that's critical. And during this pandemic, for the next 2 weeks, there's a 25% off, and that's my contribution, and the code is 25 no panic, only for recorded courses, not for live stuff. And we're doing tomorrow on March 21st and 22nd, a live webinar. Everyone needs to be there. There's going to be tons of new stuff, tons and tons and tons. And you could find these courses, by the way, at teachdoctors.com to sign up on. I urge you, get qualified, get educated, learn how to read MRIs, understand stroke, understand concussion, understand connective tissue pathology, understand spinal biomechanics and triaging the injured. I urge you, understand all of those things. It is critically important to the future of your career. Now, let's talk about paying staff. Under the Fair Labor Standard Act. Now, you all want to pay your staff. You don't, look, your staff needs to feed their families. They need to eat and have a roof over their head. But again, you don't want your staff in the office if they're not essential, and you don't want them spreading, germs to you and you to them. You want to really keep people isolated as much as you can. But you have to understand the Fair Labor Standard Act. And these are the federal guidelines. New York follows them. Most other states follow them also. So just be aware of that. It might not be your state, but most do. So employers can have contracts that clearly describe payment practices. And if so, those contracts have to be followed. Now, if any of you purchased our staff office policy, which all of you should have, you're golden. Everything is clearly outlined and there's no ambiguity and you have no issues. So you have to though understand, to understand who gets paid and not, what is an exempt versus a non-exempt employee. There are two basic types of employees in the workplace, exempt employees and non-exempt. The difference, what is the difference between these two workers and the jobs they hold? The most significant difference is paying for overtime work. The term exempt means they're exempt from being paid overtime. And that's usually a salaried worker making at least $23,600 a year and at least $455 per week. So they're paid on a salary and perform salaried job duties, exempt duties. And those requirements are outlined clearly by the Department of Labor. In other words, they regularly supervise 2 or more other employees, or they have management as part of their duty, and they have some genuine input into their job and other employees as far as hiring, firing, promotions, etc. But really, and that's just some guidelines. But the issue is if they're a full-time employee making at least $455, then they're exempt from the the Fair Labor Standard Act. Part-time employees are the ones that you're concerned about. Non-exempt employees do not have to be paid unless they work. Non-exempt part-times don't need to be paid when they don't work if their remaining weekly salary divided by the number of hours worked in the weeks exceed the federal minimum wage. Meaning, they don't have to be paid. Say they work part-time Monday and Tuesday, and they work 10 hours Monday and 2 hours Tuesday, but they take Monday off and only work Tuesday. So you have to take the total number of hours they've worked, which is 2, divide what they make into 12. And if the number comes below the minimum wage, then you have to pay them the minimum wage. Exempt employees, full-time, must be paid if they do any work, even a single email in the week from home. You have to pay them. That's the federal law. If they answer a telephone call, you have to pay them. That's the federal law. The employees can be dock pay in full day increments. By the way, you don't have to pay them for the week. I apologize. They could be dock pay in full day increments if you only answered a question on Monday and not Tuesday, Wednesday, Thursday, Friday. You have to pay them for Monday, but not the rest of the week. If the employer is open, the employer takes the entire day off. If they have a bona fide sick leave policy, meaning right now they're taking time off and you've got a sick leave policy, they're sick, they're worried about the virus, they have a cold, the cough, whatever. In your staff office policy, you've already defined how much sick time they have, and that goes under that. So it's a little straight and it's a little circuitous. It took me, honestly, about 8 or 9 conversations with the labor lawyer to fully understand this, but I hope that I put some clarity. Now, a lot of doctors are just firing staff because they'll make more money on unemployment. However, there's another solution. Let's talk about money. Again, I'd like to thank Dr. Barone for Citizens Bank and Dr. Manoni for the Small Business Administration as we've been scrambling the last few days. Chris said, can't find 449944. Chris, you have too many 4s in there. 99, oh, you don't. 99, my glasses are wrong. It was in the fee book. So I don't know the answer to that. And progressive is stopped. I'm not even talking about progressive right now. Okay. If someone could just post up on here what the fee is in the fee book for your region, because we got that the other day. It worked well. Okay. Now, Citizens Bank right now is probably one of the best in the nation in refinancing. If you have equity in your home, if you have a mortgage, if you have a mortgage on your office, I know one of my kids just refinanced with Joe Bart from Citizens Bank. This is his cell number. He handles all 50 states, and he saved, God, I think about a half a point. And it's coming down even further. These are unprecedented times. It just is. In certain scenarios, depending upon how much you're refinancing, he actually has 2.75% loans. One of my kids got a 3.75 loan based upon their scenario. So this is a good resource, and now is the time to do it. Some people are being proactive and taking additional cash out of their home and just leaving it on the sidelines, and when the coast clears, they put it back in, or they keep it out and do whatever you want, but now's the time. Now, the SBA, the Small Business Administration, they will give you a loan at 3.75% up to 30 years. However, here's the cool part. There is a potential forgiveness for staff salary usage on loan proceeds. It's available, meaning if you're using part of that loan to pay your staff, you can be forgiven on that note, and the government will absorb that. You have to negotiate that when you negotiate your note. Now, you could get to them. It's going to get crazy. I'm trying to find someone. There's someone out of Florida. Dr. Erickson is working on getting that person's name and phone number to me, who knows how to work through the whole procedure and system, because it can get a little dicey. You know, you're dealing with the federal government. But can you imagine that? Hey, you pay all of your staff for the next 3 months out of this loan. You document that through payroll stubs, etc., payroll reports, and that's forgiven. It's a very good thing and something that everyone should consider doing. And I would look into that immediately. And you can go right here to sba.gov/funding-programs loans. And what I just did is Googled Small Business Administration loans. I clicked on it and it popped up. Matt, are you on, Erickson? Let me look at the sheet. If you are, unmute your phone.
Yeah, I'm here.
Hey, Matt. Matt, did you get the name of that person?
Yeah, I emailed it to you. You didn't get it?
I wasn't able to look. Could you just give everyone her name and phone number?
Yes, I'll do it. Let me just pull this up. So it's Kimberly Schneider and Emory Advisory Group, for those that want to know. 801-712-0127.
Could you please repeat that?
801-712-0127. Kimberly Schneider.
And tell her that you were referred by Dr. Matt Erickson and the Academy of Chiropractic. And that's important. You could tell Joe Bart from Citizens Bank that you were referred from Dr. Mark Student and the Academy of Chiropractic. That will help, because then they'll know where you come from, and you're not fishing. They'll know you're more serious. Matt, thank you so much. I appreciate your diligence on this. Okay.
She's great.
Yeah, that's great. So, Mark Weiss, if you're not paying your workers, are they laid off or fired? I don't know the answer to that. I can't answer that, but I can have the labor lawyer. If everyone wants to email me a labor lawyer question, I mean, honestly, this labor lawyer, it's like a $500 an hour lawyer, but he'll answer any question that I have at any time. That's the kind of relationship I have, and I will get that. But it's a very, 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 very good question. Okay, now, we have to prepare for a quick start on opening day. And we're going to talk about lawyer seminars and not really too much about Simverta, even though I just want to mention it. It is an unbelievable piece of technology in X-ray digitizing that it's a slam dunk with medical providers and specialists. Because when an MD says, oh, there's non-specific back pain, it's very specific. And what this technology does is it very clearly and specifically shows you demonstratively where the pathobiomechanical lesion is, based upon evidence, the literature, and the AMA guides. It's all literature based. It's wonderful. Now, I really don't, and for lawyers, it's documentation. It shows where the connective tissue strain sprain is and why it's permanent. It's just incredible. And every day we just get more and more accolades out of it. Now, you ready? This is one of the coolest things. Out of confusion comes clarity. Out of fear comes strength. We opened with that. This is one of those things where it's enabled me to really focus. And I'd like to thank Dr. Josh Johnson. Josh, if you can unmute your microphone, that'll be great. And once you do that, just say hello.
Hello.
Josh, I want to thank you. This was your idea to do a webinar for everyone around the country. So I just wanted to, I don't know how you came up with that idea, but it was great. So I just want to give you credit where it's due. But so thank you.
Absolutely.
Now, starting next week, I am going to have a webinar. And I went out and purchased, a $3,000 webinar portal. I mean, it was big time stuff, so that I could accommodate the multitudes. I really chinsed out before when we did a go-to-meeting session. It was only $500. Now I had to, dig deep for this one. All joking aside, we want to keep your referral sources engaged. We want to keep your lawyers engaged. We want to keep you engaged with them. So we're going to give you, everyone in the program, everyone, an opportunity to invite every single lawyer to a 90-minute lawyer seminar. Each session is 90 minutes. We're going to have one on age dating herniated discs, one on low-speed accidents and serious bodily injury, one on understanding colossus, one on strain sprain is serious and a permanent bodily injury, and so much more. We're going to do sample cases, and we're just going to pump these out once to twice a week. It'll be during the day. It won't be in the evening, and everyone can invite any lawyer they choose. So you could be on, you could invite 10 lawyers to come on, and I'll be highlighting our credentials as a whole, our ability to educate attorneys individually and manage cases. And you get to call the lawyers when you're done and say, did you understand this? Did you understand that? I have research. Let me send over, federal copyright laws say I can't send you the research, but I'm going to send you the citation and a snippet from that research so you understand it, and we're going to talk about it. It's going to give you a continual opportunity to engage with attorneys and on an ongoing basis, be able to communicate with them. And it's going to be great. And I'm excited. This way, it's almost like me doing a lawyer seminar for you, not quite, because I'm not there with you on that pedestal, but you get to take the reins and stand on that pedestal when we're done. I'll have a whole system behind that for you to be able to do it. So we're going to start that next week. And also to let you know, there's going to be a nominal fee, like $10 a head, just something that I could just, recover some of the cost of all the things that I've spent to make that happen. But it'll be easy. It'll be fun. It'll be dirt cheap. And it's going to be great. And I'm going to take suggestions on ideas. Are there any does anyone have any suggestions for topics other than what I put here? Anyone, you can unmute your mic and shout out now. Anyone? Okay.
To show some of the
Say again, please.
Hey, Mark, how about things with ligament laxity?
Okay. Ligament laxity really goes under strain sprain, but that's ligament pathology. But yeah, okay. I just wrote it down. Thanks, Aaron. I recognize your voice. Next.
Chiropractors as the primary spinal care specialist.
PCs as primary spine PSC. Got it. Next.
maybe to show how we co-manage, could do a talk on interventional pain management possibly. I could help you with that. I just did one yesterday.
Co-manage cases with pain management. Okay, what else? I'm writing as we speak.
Maybe teach the attorneys how to use the narratives to more effectively negotiate the settlement, because sometimes you do great reports and they don't get it.
How to use narratives. How to use narratives in settlements. Or yeah, they've got to get past Colossus. But okay, but that's a good one. What else?
Hey, Mark, this is Rob. How about the stuff leading up to Symvetra?
Symverta.
So some introduction to the attorneys about that.
Perfect. Yeah, that's a good one. Okay. Yeah, that's how to document strain sprain. That's number 4 up ahead. But yeah, that's good. One more?
How to take our most commonly diagnosed injuries and talk to claims adjuster. 6th grade language, explain injuries to claim adjusters.
Chat to adjuster.
That'll tie in the paralegals.
The bodily injury. Okay.
One more if you got a sec. Trends that you see that may be hitting their states.
It's a national trend. There's no such thing as a state anymore, because there's a one national standard that the carriers do. And I've noticed that over the past 5 or 6 years, it just sweeps the nation instantly because the carriers put out a standard. But okay, trends. Let's talk about trends, because trends, national, state, it doesn't matter. It's still trends. Okay.
Well, yeah.
Okay, I'm good. Now, next. Lastly, doctors webinars. If I have enough time after we do that, we're going to have doctors webinars for you and us, okay, on documentation, compliance, lawyers meetings, how to meet with attorneys individually, how to meet with MD specialists individually, sprain pathology, spinal biomechanics, all these things. And by the way, if you're not part of tomorrow's webinar, we're going to be spending half of it on spinal biomechanics. I mean, there's so much new stuff and how to make it demonstrative and understand it. I'm going to be showing a tremendous amount of new information on MRIs. Okay, we're going to do a lot of pathology, not just basics, but I have to do some basics because I've got new people on. We're going to talk about exactly how to engage the emergency rooms and urgent cares, exactly how to get the primary care providers to wake up and open their eyes, how to get the lawyers to understand. There is a tremendous amount of information. What we're doing is working. It's working. As of this second, I mean, this is something I'm proud of, but a real number. Let me just find that number for you. We are at 1,043,000, 1,040,000 here. This is how many referrals that we've gotten into your offices nationally. And I think that's a false number. I think that number is probably close to double, but that's all I can say with a great degree of certainty. What we're doing is working at just unprecedented levels. I mean, I've never been so excited as to what's going on and what we've been doing. It's just working. Now, with that being said, any questions briefly? Let's open the floor. Open your mics, open the floor. Questions? Going once? Going twice? Okay.
Hear me?
Go ahead.
Yeah, as far as ideas for the attorneys, the pre-existing arthritis, and then how to use chiropractors as a PIME source.
I like that, PIME, okay. This PIME, got it. Okay, anything else? All right, listen, folks, this took exactly an hour. I was thrilled. I would like to thank everyone. Listen, don't be discouraged. Don't worry about your practice. We're all in this together. We're going to get through this together. We're going to be stronger at the end. We're going to use all of our tools for practice, for finances. We're going to hustle. We're going to get things done, and life is good. And just remember, and I mean this sincerely, before you go away, the people you're talking to on the phone, your patients, most of them are not as secure or well off as you are. There are people in your community, in your churches and synagogues and mosques. They all need our support. You know, we don't need to do any racial bashing about this virus. That's absurd. You know, we're all in this together. So, you know, put a hand out with a palm leaf with humility and just embrace everyone in your world. I'd like to thank everyone so much for spending a little bit of time with me. And if you all need me, I'm here. Have a great day, everyone. I'll put some music on to go out. A little bit of sweetness.
Oh, honey, honey, you are my king, girl, and you got me wanting you. Honey, oh, sugar, sugar, you are my king, girl, and you got me wanting you. I just can't believe your love is so lovely. I just can't believe it's true.